everyone, ಇವತ್ತು ನಾನು ಬಂದಿದ್ದೀನಿ ಡಾಕ್ಟರ್ ಮೋಯಿನ್ ಅವರ ಕ್ಲಿನಿಕ್ಗೆ. ಡಾಕ್ಟರ್ ಮೋಯಿನ್ ಬಂದು ಇಂಡಿಯಾಸ್ ಲೀಡಿಂಗ್ ಬೇರಿಯಾಟ್ರಿಕ್ ಆ್ಯಂಡ್ ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿಕ್ ಸರ್ಜನ್ಸ್. ನಾನಂತೂ ಅವ್ರನ್ನ ಮೀಟ್ ಮಾಡೋದಕ್ಕೆ ತುಂಬಾ ಎಕ್ಸೈಟ್ಮೆಂಟಲ್ಲಿದ್ದೀನಿ ಆ್ಯಂಡ್ ಅವ್ರಿಗೆ ಒಂದಷ್ಟು ಕ್ವೆಶ್ಚನ್ಸ್ ಕೂಡ ಕೇಳೋದಿದೆ. ಸೊ ಬನ್ನಿ ಅವ್ರನ್ನ ಮೀಟ್ ಮಾಡೋಣ.
ಹಲೋ ನಿವೇದಿತಾ.
ಹಾಯ್ ಡಾಕ್ಟರ್, ಹೇಗಿದ್ದೀರಾ? ಸೊ ಡಾಕ್ಟರ್, ಬೇರಿಯಾಟ್ರಿಕ್ ಸರ್ಜರಿ ಅಂದರೆ ಏನು ಮತ್ತು ಅದು ಹೇಗೆ ಹೆಲ್ಪ್ ಮಾಡುತ್ತೆ ಪೇಷಂಟ್ಸ್ಗೆ?
See, bariatric surgery word is derived from the word called Barros. Barros means overweight. Overweight, the surgery done to treat overweight is called bariatric surgery. So basically it's a weight loss surgery where we reduce the size of the stomach, the patient can eat less and even the cravings come down, the hormonal changes happen which will melt fat from everywhere.
ಯೂಶಲಿ ಪೀಪಲ್ ಸರ್ಜರಿ ಅಂತ ಅಂದ ತಕ್ಷಣ ತುಂಬ ಹೆದರ್ಕೊಳ್ತಾರೆ. ನೀವು ಏನು ಹೇಳ್ತಾರೆ, ಎಷ್ಟು ಸೇಫ್ ಇದೆ ಈ ಸರ್ಜರಿ?
Surgery is a fear for many of the people. So as soon as we say surgery, they require the whole family support, they sack everything. So what happens is, to be very frank, whoever comes to us, they may feel very scared initially, but after talking to us, they comfort themselves and slowly they go into the mode that they started trusting us. Then definitely I try to explain the same thing to their relatives and family and friends who accompany them. So as a combined decision, slowly I think after speaking to few of our old patients, definitely they say yes to the surgery.
ಈ ಒಂದು ಸರ್ಜರಿಗೆ ನೀವು ಯಾವ ಥರ ಪೇಷಂಟ್ಸ್ನ ರೆಕಮೆಂಡ್ ಮಾಡ್ತೀರಾ?
So whoever walk-ins into our OPD, we don't recommend the surgery. We recommend the surgery for the people who are 25 to 30 kgs more than their actual weight. We operate them, and people who are 50, 60, 70 kgs excess weight, we definitely recommend them as the first option.
ಸೊ ಈಗ ಒಂದ್ಸಲ ಈ ಪೇಷಂಟ್ ಈ ಒಂದು ಸರ್ಜರಿನ ಅಂಡರ್ಗೋ ಮಾಡಿದ್ರೆ ಅವ್ರು ಎಷ್ಟು ಬೇಗ ಅವರ ಒಂದು ರೆಗ್ಯುಲರ್ ವರ್ಕ್ಗೆ ರೆಸ್ಯೂಮ್ ಮಾಡ್ಬೋದು?
ಸರ್ಜರಿ ಆಲ್ಮೋಸ್ಟ್ ಲೈಕ್ 1 hour ಆಗುತ್ತೆ. ಆದಮೇಲೆ ನೆಕ್ಸ್ಟ್ ಡೇ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡ್ತೀವಿ ನಾವು. ಆಲ್ಮೋಸ್ಟ್ ವಿತಿನ್ ಎ ವೀಕ್ ಪೇಷಂಟ್ ರೆಸ್ಯೂಮ್ ಮಾಡ್ಬೋದು ಆ್ಯಕ್ಚುಲ್ ವರ್ಕ್ ವಾಟ್ ಎವರ್ ಈಸ್ ಡೂಯಿಂಗ್.
ಲೈಪೋಸೆಕ್ಷನ್ಗೂ ಮತ್ತು ಬೇರಿಯಾಟ್ರಿಕ್ ಸರ್ಜರಿಗೂ ಡಿಫ್ರೆನ್ಸ್ ಏನು?
ಸೊ ಬೇರಿಯಾಟ್ರಿಕ್ ಸರ್ಜರಿ ಈಸ್ ಅ ವೆಯ್ಟ್ ಲಾಸ್ ಸರ್ಜರಿ ವೇರ್ people lose weight from different parts of the body like face, hands and legs, whereas liposuction we remove fat from specific areas of the body. So liposuction is basically a body contouring surgery. Bariatric surgery is a weight loss surgery. So in bariatric surgery people lose around 30, 40, 50 kgs of overweight. In liposuction they may not lose much, but they will have body contouring wherever it is needed.
ಸೊ ನೀವು ವೇಟ್ ಲಾಸ್ ಬಗ್ಗೆ ಮೆನ್ಷನ್ ಮಾಡಿದ್ರಿ. ಒಂದ್ಸಲ ಪೇಷಂಟ್ಸ್ ಈ ಒಂದು ಸರ್ಜರಿನ ಅಂಡರ್ಗೋ ಮಾಡಿದ್ರೆ ಮತ್ತೆ ವೇಟ್ ಗೇನ್ ಆಗುತ್ತಾ?
Sir, actually there are two different types of surgeries. One is gastric sleeve, one is gastric bypass. In gastric sleeve we reduce the size of the stomach, so the eating capacity is reduced. In gastric bypass we reduce the stomach and join with the intestine, so basically the quantity of the stomach is reduced but the food is also bypassed. So if we do more of bypasses in our center, gastric bypass has very less weight regain. Gastric sleeve may have some weight regain, but gastric bypass the chances are very less.
ಇವಾಗ ನೀವು ನೋಡ್ತಿರಂಗೆ ಎಷ್ಟೊಂದು ಜಿಮ್ಸ್ ಇದೆ, ವರ್ಕೌಟ್ಸ್ ಮಾಡ್ಬೋದು, ಡಯಟ್ಸ್ ಮಾಡ್ಬೋದು, ಬಟ್ ಏನಕ್ಕೆ ಈ ಒಂದು ಸರ್ಜರಿ ಅಂಡರ್ಗೋ ಮಾಡೋದಕ್ಕೆ ನೀವು ರೆಕಮೆಂಡ್ ಮಾಡ್ತೀರಾ?
Everyone has to follow diet, exercise and all. Usually they try and they should try also. Some people may lose some weight, some people may not lose, like for example young women who are hypothyroid and PCOD, they may not lose any weight at all. So those kind of patients, even though they try gym and all, they may lose 3 kgs, 4 kgs, beyond that they are not losing. So they will lose that enthusiasm to do something more. So I think those kind of patients really can opt for surgery, and patients who are very morbidly obese like almost 150 kg, 120, 130, 160, 200, they don't have any option. Diet and exercise may not help them much. So I think for the people who are repeatedly gaining back their weight, I think bariatric surgery is one of the option they should consider really.
ಈ ಒಂದು ಪ್ರೊಸೀಜರ್ ಹೇಗೆ ನಡೆಯುತ್ತೆ?
This surgery basically it is not in open surgery, it's a keyhole procedure where we put a small holes in the tummy and do the surgery. This patient will get admitted 1 day prior, do all the tests to check his liver, kidney, everything. Then when there is a nod from anesthesia and surgeon side, we operate next day. The surgery we do within an hour and we mobilize the patient within 2 hours. and next day we discharge the patient. That's how simple it is.
ಸೊ ಈ ಒಂದು ಸರ್ಜರಿಗೆ ಮೆಡಿಕಲ್ ಇನ್ಶೂರೆನ್ಸ್ ಎಲ್ಲ ಈಸಿಯಾಗಿ ಸಿಗುತ್ತೆ?
Yes, medical insurance are covering recently, but yes, corporate insurances coverage is very high. Individual insurance also, but there is some terms and conditions for the insurance to get covered. Not everyone is covered. I can say now with my experience around 7 out of 10 are getting covered.
ಆಲ್ಸೋ ಡಾಕ್ಟರ್, ಐ ಹ್ಯಾವ್ ಅ ಡೌಟ್. ಇವಾಗ ಎಷ್ಟೊಂದು ಪೇಷಂಟ್ಸ್ ಬಂದು ಡಯಾಬಿಟಿಕ್ ಇರ್ತಾರೆ. ಈ ಒಂದು ಸರ್ಜರಿ ಆದಮೇಲೆ ಅವ್ರು ಇನ್ನೂ ಅವರ ಡಯಾಬಿಟೀಸ್ ಮೆಡಿಕೇಶನ್ ತಗೋಬೇಕಾ, ಹೇಗೆ?
See, over a period of time, what happens is the patient will be taking a lot of medicines. So post-surgery, what happens? Whatever natural insulin produced by the pancreas starts getting absorbed better way. So I think we don't need to supplement anything from outside. So we reduce the medications slowly and gradually. I think many of the time, 95% of the times we stop the medicine for diabetes for the patient. 5% of the times we may reduce the dosage of medicines.
ನಾನಂತೂ ಇದನ್ನು ಕೇಳಲೇಬೇಕು. ಐ ಆಮ್ ಶ್ಯೂರ್ ನೀವು ತುಂಬಾ ಸರ್ಜರೀಸ್ ಮಾಡಿದ್ದೀರಾ ಎಲ್ಲ, ಬಟ್ ಅದರಲ್ಲಿ ನಿಮಗೆ ಒಂದು ಫೇವ್ರೆಟ್ ಆ್ಯಂಡ್ ಮೆಮೊರಬಲ್ ಸರ್ಜರಿ ಅಂತ ಏನಾದ್ರು ಇದ್ದರೆ ಆ ಒಂದು ಸ್ಟೋರಿ ಶೇರ್ ಮಾಡ್ಬೋದಾ?
I remember almost 8 years back, a patient from Chamraj Pete, a flower merchant. He came with a diabetic ulcer in the foot. The wound was discharging and all. He was a heavy diabetic. So a patient was very heavy and he was unable to walk, 150 plus kgs. So he came and he asked, "Surgery, can we do the surgery? Because we tried everything, the sugar is not getting controlled, the wound is not healing." So what I did is I did the surgery for the same patient with a wound in the leg. So post-surgery, you will not believe, within a month, almost the wound started healing.
Oh, wow.
Because it's got controlled, because the sugars got controlled post-surgery, it started healing. I think I remember almost by 3 months, the wound has healed completely for that patient. So in that way, I think we can say it's a new life for him and diabetes-free life.
ಸೊ ಅಟ್ ಲಾಸ್ಟ್ ವ್ಯೂವರ್ಸ್ಗೆ ಏನು ಅಡ್ವೈಸ್ ನಿಮ್ಮ ಕಡೆಯಿಂದ ಕೊಡ್ಬೋದು?
Yeah. So basically, sugar is your enemy. Stay as far as possible, and I think the more sugar you consume, the early you die. So I think stay away from sugar and be fit. And what I want to say is don't stop completely carbs. Keep carbs, because carbs requirement is 70% in the body. 20% is almost protein and 5% fat. So you take in that equal amount of what I suggested, because don't stop carbs completely, because you see a lot of advertisements, completely you stop carbs. Carbs is very much required for your energy. If you stop completely carbs, what happens? You get dizzy, you may fall down in the daytime, and also keep the quantities alive, and 70% carbs, 20% proteins and 5% of fat is, I think that's advisable, and that is the basic requirement of the body. I think whatever the new diets come, but you still maintain this as your routine.
ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಈ ನಿಮ್ಮ ಜೊತೆ ಮಾತಾಡಿ ತುಂಬ ಖುಷಿ ಆಯಿತು. ಇಷ್ಟೊಂದು ಇನ್ಫಾರ್ಮೇಷನ್ ತಿಳ್ಕೊಂಡು ನನಗೂ ತುಂಬ ಖುಷಿ ಆಯಿತು. ಆ್ಯಂಡ್ ಐ ಆಮ್ ಶ್ಯೂರ್ ದ ವ್ಯೂವರ್ಸ್ಗೂ ಕೂಡ ತುಂಬ ತಿಳ್ಕೊಂಡಿರ್ತಾರೆ. ಆ್ಯಂಡ್ ಎನಿ ಡೌಟ್ಸ್ ಅವ್ರಿಗೇನೇ ಬಂದರೂ ಕೂಡ ಅವ್ರಿಗೆಲ್ಲ ಒಂದಷ್ಟು ಡೌಟ್ಸ್ ಏನೇನಿರುತ್ತೆ ಅದೆಲ್ಲ ಕ್ಲಿಯರ್ ಆಗಿರುತ್ತೆ. ಮಾತಾಡಿ ತುಂಬ ಖುಷಿ ಆಯಿತು. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
ಥ್ಯಾಂಕ್ ಯು ನಿವೇತಾ. Influencer thing, you should be aware, what is your point of view before coming here and after coming here?
ವೆಲ್, ಬಿಫೋರ್ ಕಮ್ಮಿಂಗ್ ನನಗೆ ಅಷ್ಟು ಅವೇರ್ನೆಸ್ ಇರಲಿಲ್ಲ. ಸೊ ನನಗೆ ಇಲ್ಲಿ ಬಂದಾದಮೇಲೆ ತುಂಬ ತಿಳ್ಕೊಂಡೆ ಹೇಗೆ ಸರ್ಜರಿ ನಡೆಯುತ್ತೆ, ಎಷ್ಟು ಯೂಶ್ವಲಿ ಸರ್ಜರೀಸ್ ಅಂದರೆ ಭಯ ಇದ್ದೇ ಇರುತ್ತೆ. ನಾನು ಕೂಡ ಓಕೆ ಮೇ ಬಿ ವೆರಿ ಸ್ಕೇರಿ ಅಂತೆಲ್ಲ ಅಂದ್ಕೊಂಡಿದ್ದೆ, ಬಟ್ ಇಟ್ಸ್ ಅ ವೆರಿ ಸಿಂಪಲ್ ಪ್ರೊಸೀಜರ್ ಆ್ಯಂಡ್ ಇಟ್ ವಿಲ್ ಹೆಲ್ಪ್ ಅ ಲಾಟ್ ಆಫ್ ಪೀಪಲ್. ಬೆನಿಫಿಟ್ ತುಂಬಾ ಬೆನಿಫಿಟ್ಸ್ ಇದೆ, ಎಸ್ಪೆಷಲಿ ಅವ್ರಿಗೇನಾದರೂ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ ಎಲ್ಲ ಇದ್ದರೆ ಅದೆಲ್ಲ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ಆ್ಯಸ್ ಯು ಸೆಡ್ ದಿಲ್ ಗೆಟ್ ಅ ನ್ಯೂ ಲೈಫ್.
ಕರೆಕ್ಟ್.
So I got to learn that from you.
Thank you Niveditha.
Hey everyone, do check out Surgeon Flix and follow him for more updates.